the results of the ZUMA-7 trial, which we presented here, really make it clear that we should be moving CAR T-cell therapy up as an earlier line of treatment. Really, the critical thing here is to get a patient referred very early to a treatment center that does CAR T-cell therapy. And by that, if you have a patient with large B-cell lymphoma that's primary refractory or has progressed after initial frontline treatment, they need to immediately be referred for consideration of CAR T-cell therapy. And in fact, they could avoid second-line salvage chemotherapy and go directly to CAR T. That's what we've shown on this ZUMA-7 study. And the critical thing that I think is important is that they're referred quickly and early, because time matters when it comes to treatment for diffuse large B-cell lymphoma. The manufacture of CAR T-cells can be done relatively efficiently and quickly, 3 to 4 weeks, depending on the manufacturer. But you've got to get the patient referred in early and quickly so we can get that therapy to the patient, because it's clearly the best treatment in my mind for these patients.